Hi, this is Chad Clark, and I want to we've been getting questions on doing a video on vestibular therapy for dizziness. So there is a difference between dizziness and the actual vertigo. So a really quick thing you can ask yourself is, when you feel those symptoms, are you spinning, or is the room or the surroundings appear to be spinning? So for example, if I'm standing here and I'm spinning, or I feel that sense, that would be more dizziness. It can be there with vertigo as well. Now, in that another scenario, if I'm standing here and the whole room's spinning in different directions, that's more vertigo. So there's dizziness if it's more internal and you're spinning and moving, and then there's vertigo, which is the surroundings, the environment. So I hope that clears that up. Now, what to do about that? Sometimes it's almost this simple, and I'm just going to sit down here. If it is the dizziness where I feel like, when I stand up, whoa, I get a little lightheaded, obviously get cleared by your doctor, and if you haven't seen a doctor in a while, for blood pressure and anything else internally that might be neurological and something more severe, please check that out. I know it's a low percentage that something really bad is happening, but it's better to get your heart checked out and make sure it's not that. Now, dizziness, sometimes it's just we're anxious and we're deep breathing and more chest breathing. So just sit there and simply do a belly breathing. So instead of breathing up here, breathe here in your lower rib cage. Really expand all the way down to the deepest lung, into the deepest parts of the lungs. And you can do that just simply take your time, breathe through the nose, exhale through pierced lips. Then try that and stand up and see if those symptoms occur. Do a few breaths, at least 5 in a row. It might even take a minute or so to get 5 deep breaths. It'll slow things down. That can help. Now, if it's a little more vertigo, or it's stated about 80% of the time, that's 80, so 8 times out of 10, a person will have what's called a benign proximal positional vertigo. And really, the thing that works almost every time on those people, if this is truly what it is the Epley maneuver, which you could do to yourself. So if you have several pillows or a big thick pillow, and you have problems either to the left or the right, if you've kind of narrowed that out where, oh, I'm always worse when I go to the left or right, you would sit, maybe do this on your bed, turn your head 45 degrees, lay back rather quickly. If you need someone to help you, you can do that, and let your head either hang off the edge of the bed or off the pillow. Now, if you experience symptoms, hold this position until they go away. Then you'll turn your head to the other side and make sure you do the same thing. Then you'll end up turning your body, looking down, hold until the symptoms go away, and then come up to a seated position. So if I did that the opposite way, I turn my head 45 degrees, come down, let my head hang off the bed or off the pillow until my symptoms go away. Do that on the other side. Then turn my body as I'm looking down, and then come back up. Now, it might not go that fast. I'm just showing you rather quickly. Sometimes I had one person, it took literally 20 minutes, because every position we had to hold 5 minutes or so, because his eyes were twitching and the room was spinning. You want to make sure it goes down. It's scary to do that, so you might want to have someone else there, or better yet, maybe come see us or someone locally that can help you with that at least one time. That's always a good thing to do. And then it's a nice home workable thing that you can do and take it with you even if you travel. So there's one thing we went through for dizziness, some deep breathing, and then the vertigo, the Epley maneuver. There's some other maneuvers and more advanced techniques, but that should really help a majority of the people. Like always, if you need more help, definitely call us or go somewhere that can help you, because I know people that watch this aren't necessarily in our town, and I hope that helps.